We're going to talk a little Cyber Saturday. And again, I'm Blake Schwank with CCS IT Pros. And I'm joined today by my friend, Terry Bradley. And who are you with, Terry Bradley? What do you guys do?
Hi, Blake. I'm Terry Bradley. I'm the president of Mile High Cyber, and we help small and medium-sized businesses manage their cybersecurity risks and identify unseen problems that may come and get them.
So that's awesome. Yeah, keep an eye on your clients. So, but Terry and I were just chatting about the Change Healthcare breach that happened February 21st. And this is impactful to us. We're both veterans. We both, this is having a huge impact on the military community. And, from the VA to the military installations, we're both here in Colorado Springs, where we have, 5 military installations and then, and several military hospitals. And what they have been putting out at the hospitals is that their pharmacies are not able to do electronic transactions at the moment, thanks to the Change Healthcare breach. What do you do? You were reading up a little bit on the Change Healthcare breach. Do you know what happened, Terry?
Well, it's still early days, and they're busy trying to put out this fire, and so they haven't had a lot of time to, craft press releases at this point. But it looks like it could be connected with the ConnectWise Screen Connect vulnerability that was announced last week. This is a remote management tool that IT professionals use to log in remotely to systems to troubleshoot them or fix them or update them. And the software itself had a serious security flaw that allowed attackers to get into systems that were using that software. If that is the case, that might explain the initial access for the criminals who did this act. But once they got in, the assumption is they deployed ransomware. So they encrypted files and computers on the Change Healthcare network so that they're not able to process prescriptions or do the thing that generates revenue for them.
Yeah, and this is I think the largest pharmacy provider or payment processing provider, I think I was reading. And so it affects the military, also affects just your average person or somebody that is getting care through TRICARE. It's impacting the Veterans Administration, the VA. If you go to va.gov, they've got a notice up there that if you are being served by a medical facility contracted by the VA, that you can actually go to the VA and they will help you fulfill your prescriptions. But all of these organizations that are dispensing prescriptions that are supported by the system are having to manually do it. So they're manually filing prescriptions and so they're taking care of the highest priority prescriptions. The military, you go out to some of the military hospitals and their Facebook page or whatever is saying that they are taking care of pain meds, they're taking care of emergent cases, inpatient cases. But if you just have an average prescription, the best bet is to stay away for now. You're not going to get it filled and let the most critical ones go through. The other thing, Terry, I saw that is for people that have expensive prescriptions, they cannot do the payment processing with the insurance company. And so it's one thing if you're going and getting a $50 prescription that most people can put that on a credit card or cash or something. But, I've read some sad cases of people that have $1,000, $2,000 prescriptions where they're spending hours and hours on the phone. And, the longer this goes, it's gone 7 days so far, that's just going to get worse and the backlog's just going to get worse. So if you have a prescription coming up, make sure you check it out. Make sure that you plan ahead. Don't wait to the last date to get it refilled at this point, because if this has gone on for 7 days, it might go on for another 7 days. And we saw that with, I think, MGM and Caesars a couple months ago, is they were down way longer than anybody ever thought that they would be. And so make sure you take care of it. If you're military, make sure you check with the military hospital, check with the VA. The VA's got an 800 number up on their website to reach out to. That's what they can do now. What about people that are concerned about, do we know if they exfiltrated any data, if they have their patient information, their private information? Did you see? I didn't see anything on that. Did you, Terry?
Well, the healthcare company hasn't released that information yet. And as far as we know, the threat actors haven't released that. But that's almost certainly going to be the case. Nowadays, we're seeing, what they call double ransomware. In some cases, what some people are calling triple ransomware. So it's very common for the bad guys, before they lock up all your systems with ransomware, to steal copies of all the sensitive information and use that as a bargaining chip. If the victim decides they don't want to pay for the decryption, or they're not going to pay the ransom, then they'll use that patient data or customer data as a bargaining chip. And then if that doesn't work, then they'll look through the data and look for ways to extort them. And so it's very likely that even though right now there's I'm sure they would say there's no evidence of patient data being taken, it's almost certain that is the case, and it will come out in the end, in the final analysis, because there will be fines and there will be penalties for not updating systems as quickly as they should have, or not having the right security measures in place.
Right. Yeah. And so if you think you're affected by this, if you're not affected by it, there's at this point, if they download your medical records or your medical information, that has key identifiers, your social security number, your address, some of those other things might be in this dump. Make sure that whether you're affected or not, the safest route is to go and lock your credit. Go to the carriers, go to Equifax and TransUnion and what's the other one, Terry?
I've lost track of them all. They keep changing the names.
Anyway, but go to the credit bureaus, put in a lock. You can do a lock for free, right? And that means that anytime you want to get credit somewhere, whether it's at Lowe's or Home Depot, you'll have to make a phone call to the credit union or to the credit bureau to unlock that credit. It's worth the hassle to protect yourself. As a business, so Terry, I'm kind of surprised that that a company this size did not have a good DR plan. But the more I look at some of the stuff that we support, larger companies, you could have a good DR plan, that disaster recovery plan. You could have your backups, but there's probably also other systems that are in play that may have been encrypted that just provide the connectivity or something like that, I would guess, right? Because these guys have to have a backup plan.
I'm sure they do, but a lot of times the backup plans are fairly, new. The ink is still drying. They've never practiced them. What seemed to be a good plan on paper maybe was harder to execute because there were unknown factors. And so, certainly all businesses should have a disaster recovery plan, but they also need to practice it. They need to practice those restoration procedures, those backups that you've been doing for, faithfully every day for years. Sometimes when it comes time to restore them, they're just not there. Someone had made a mistake or something was misconfigured. So restoring from backup is certainly a great strategy, but it's not a cure-all. You need a kind of a layered approach. Do the prevention to make sure that you can't get attacked as much as possible. Do the detection mechanism so that when your prevention fails, and then work really hard on the response. And the response is not only having a plan, but practicing it regularly and making sure that you can execute it.
Yeah, no, that's a key thing. And we do, we've done some tabletop exercises with some of our clients. It's a big investment in time and money sometimes, but it really takes you through a lot of these scenarios and really gets you thinking and double checking all of those things. And I'm sure you do tabletop exercises with your clients where you just sit down in a conference room and start talking, you got ransomware or a truck drove through your data center or whatever, and work through all of the what ifs that might be there. So, all right, Terry, we manage the network, we manage the cybersecurity, we manage the disaster planning, disaster recovery. You're on the other side of it. You're testing the security. And so if you're out there and you need help managing your infrastructure, managing your cybersecurity, give us a call at CCS IT Pros. And if you need help testing your cybersecurity or testing what we do as an IT company, it's always good to have an external set of eyes to come in and make sure that the backups are running, that things are locked down. Give Terry Bradley a call at Mile High Cyber. And if you are out there and you're trying to find a prescription, make sure you plan ahead. If you're military, reach out to the VA or reach out to your local military hospital way ahead of time. And if you've just got a routine prescription, might want to wait a few weeks. So, any last words, Terry?
Thanks for having me on the show today, Blake. And I would just, remind people that there's a lot of unseen risks out there in the cyber world. You do your best to keep up with security updates and patches, but how do you know that the security updates, actually went? So doing that proactive vulnerability scanning to make sure that your systems are fully up to date, doing attack surface management to make sure you know what all your exposures are and when those have changed. Those are things that will, pay off big dividends when it comes time to defend yourself against an attack like this.
Yeah, absolutely. Especially now that I think I read that this might be a nation state. You've got nation states coming after you. A lot of this stuff can be automated. You can buy this software off the shelf to go attack people. It comes with an 800 number for support that they will help you attack the people you want to attack. This is not just lazy IT guys that are letting the bad guys in. These are just constant attacks, and they only have to be right once. So, Terry, I appreciate you, man, and good to see your smiling face. Thanks for jumping on here real quick with me.
Yeah, have a great weekend, Blake.
All right, see you later.